Hi, I'm Dr. Kumaresh Raj, an internal medicine and respiratory medicine specialist working in Sunway Medical Center, Ipoh. Today, I would like to talk about asthma, a condition affecting 6% of Malaysians. And May 2025 is the Asthma Awareness Month for this year. Asthma is the chronic inflammations of the airways. It typically manifests with symptoms such as cough, chest tightness, wheezing, and breathlessness. It can present in childhood or it may occur for the first time in adults. The worldwide prevalence of asthma is highly variable and is dependent on the geographic location. In Malaysia, the prevalence is quoted at 6% based on our National Health and Morbidity Survey. Risk factors for developing asthma include the genetic background and environmental exposure. For example, if one or both parents have history of asthma, there is a higher risk for the offspring to develop asthma in the future. As for environmental exposure to air pollutants including cigarette smoke, paints or pesticides have been associated with higher risk of developing asthma in the future. Also, asthma is a disease which is associated with multiple comorbidities, namely gastroesophageal reflux disease, allergic rhinitis, and chronic rhinosinusitis with or without polyposis. The diagnosis of asthma is not straightforward. This is because there are numerous conditions which can mimic asthma, as well as there is no gold standard for the diagnosis of asthma. The typical diagnostic evaluation begins with detailed history taking and physical examination. This has to be followed by some physiological testing. Examples of this physiological testing is spirometry, fractional exhalation of nitric oxide, better known as FeNO, and as well as full lung function testing if it is required. Also, in some difficult cases, a more sophisticated test known as bronchial challenge test may be required. I would like to emphasize on the importance of making the correct diagnosis of asthma so that correct treatment may be initiated early, and it is also to avoid missing sinister mimics of asthma. An asthma exacerbation is a lung attack. What happens during an exacerbation is typically the symptoms of the patient gets exaggerated, becomes more severe. This leads to the patient presenting to a healthcare facility for more intensified treatment. In certain circumstances, the patient could require admission. The worst outcome of an exacerbation is an asthma-related death. Contrary to popular opinion, asthma can actually kill if it is not well treated. Based on WHO statistics in 2020, there were about 1,013 asthma-related deaths in Malaysia. Thus, asthma should not be taken lightly. The consequence of undiagnosed or undertreated asthma is not mild. Patients who do not get the treatment they deserve will have a poor quality of life, miss work or even school, have disturbed sleep due to night symptoms, and spend days in the hospital. The worst outcome would be an asthma-related mortality. Asthma is an eminently treatable disease. Our goal in treating asthma is to achieve good disease control and avoid exacerbations. Management usually involves the usage of inhaler medications, avoidance of triggers, and addressing comorbidities. Depending on your disease severity, the doctor will prescribe you a suitable inhaler. Your compliance to this treatment and technique of using this inhaler is crucial to the success of your treatment. Also, avoiding triggers and tackling comorbidities ensures a large majority of asthma patients remain controlled. However, a small proportion of asthmatics may remain uncontrolled despite all these measures. Nevertheless, nowadays we have sophisticated medications and treatments such as biologics, a treatment which is highly effective and highly tolerable to the large majority of patients. In summary, asthma is a highly prevalent condition in Malaysia, and it is a diagnosis that needs to be clinched, as correct treatment, early treatment results in good outcome, good control of disease, and avoids asthma exacerbations or mortalities. If you suspect yourself to be suffering from symptoms of asthma, do not delay seeking treatment. You may come to Sunway Medical Center Ipoh for a diagnostic evaluation.